Hi everyone, and thank you very much for coming. I'm Allegra Spender. I'm the Federal Independent Member for Wentworth. And this morning I have brought together people from around Australia who are desperately concerned about those in our country suffering complex mental health needs and who are not getting the support that they need. About 3 months ago, my community suffered a terrible tragedy in Bondi Junction. And that highlighted to my whole community the need to support those with complex mental health needs. I was very much inspired by the words of Elizabeth Young, the mum of Jade Young, who said in her eulogy, "I want politicians, both federal and state, to address the gaps in mental health care to make it a safer world for our girls and all Australians." And I share her passion and care on this because it is such an important issue. We have 170,000 people in Australia who are suffering complex mental health needs and are not getting the support that they need. Now people aren't just falling through the cracks, they're falling through chasms of mental health support, whether it be because it's stuck between state and federal, because, it's hard to get the care that you need. You might be remote, you might be regional. We've heard some of those stories today, and that is what people are asking for, is consistent care that they can rely on, care that is going to be there in the long term, not just a moment in time and then hard to access in different points. And today has been about elevating the voices of lived experience as well as the experts in the sector, because we really have to be guided both by the community and their experience of supporting people with complex mental health needs and the challenges that covers, but also the experts who are working in this sector every single day and know what they need. There are no easy answers into this space, and I've been asked today, what's that one thing you want? The truth is there isn't one simple thing. But what we do need is actually a long-term approach. This is what the sector is crying out for. We need long-term funding and reform that drives the integration of care between the states and the federal government, but also is the funding that supports the care that is needed in the mental health sector. We need that package to be agreed in the upcoming mental health ministers meeting. That is a critical forum for that discussion. And we need that enshrined in the National Health Reform Agreement. As one of the panellists spoke to today, she said, if you've got diabetes and potential for diabetes, the healthcare services step in and make sure, do what they can to stop you developing that disease. But we do not have the same approach with mental health. We have an incidence of mental health illness which is not matched by the same level of funding, and this is a critical issue for the sector. I'd now like members of the panel and of the sector to come forward and speak, but first I will ask Elizabeth Young, who I'm very grateful came to Parliament today, and for the courage with which she has shown today in this morning. Thank you.
I'm Elizabeth Young, mother of Jade, who was murdered at Bondi Junction. I speak on behalf of my husband, my son and my son-in-law. Jade was generally identified by the media as 47-year-old architect Jade Young. For my immediate family, she was of course so very much more. She was a loved wife, a most loved mother of 2 young girls. She was our treasured daughter and PJ's beloved Jeje, Chinese for big sister. Jade was a primary victim of that devastating attack, but 3 households, 2 in New South Wales, 1 in Tasmania, are the collateral damage. Within hours of her death, in the hideous aftermath, our New South Wales families were given unconditional support. We were introduced to our police liaison person. We were guided through the first steps of recovery. In the nearly 3 months since, with the aid of specialist mental health practitioners, we are beginning to emerge from the miasma of suffering that has enveloped us as a result of Jade's death, and are trying to give the girls aged 9 and 14 a life as close to normal as possible. But not all of us have been so fortunate. Our son PJ, who lives in Tasmania with his family, received no such treatment. Being newcomers to Hobart, they firstly had to find a GP, then negotiate their own specialist support, paying out of their own pockets. After lodging an application with New South Wales Victim Services, they were given a list of 200 practitioners to seek their own help. The sole Hobart provider did not return their calls, and unfortunately the multiple New South Wales practitioners they contacted for telehealth support were similarly unavailable. After 6 weeks, our son was able to actually speak to a psychologist following his GP's escalation of his case as fitting the crisis category, with a follow-up in 2 months. When PJ and his wife attempted to find help for their children, beloved niece aged 11 and nephew aged 9, they were told there was one child psychologist, but the books were closed. The Tasmanian mental health hotline they were told to use rang out. Eventually, with the help from New South Wales, I think it was through Black Dog, a specialist trauma child psychologist has been found in Sydney, with support to be received in the coming weeks, 3 months after Jade's murder. In the extensive reading I have undertaken recently, I have been appalled that in the 30 years since the Bhattacharya report on the dire situation of the mentally ill, Australia is still vacillating. In 2008, 16 years ago, the National Health Policy announced a renewed commitment by all health ministers and ministers with responsibility for mental health to the continual improvement of Australia's mental health system. And they went on, the policy embeds a whole of government approach to mental health. The recommendations were made in the 2020 Productivity Commission report into mental health, the 2021 House of Representatives inquiry into mental health, the 2023 National Mental Health Workforce Strategy, and the 2023 review of the National Health Reform Agreement. Thousands of hours, thousands of pages, millions of dollars, numerous reports, dozens of inquiries have advised that the mental health crisis affecting our lucky country requires a national approach. After the horror of the Bondi Junction stabbings, the federal and state and territory governments committed to a national mental health ministers meeting to discuss joint action on mental health reform. Currently, 3 months on, no date and no agenda has been set for this meeting. Please, in the long shadow of the horror of Jade's death, I beg you, as the voice of 3 shattered households, please actually do something about the discrepancies, the disparities, the inconsistencies in current mental health funding and management between the federal government and states, and between states. Think as ordinary humans. Think as a mother, a father, a husband, a sister, or brother. Find the courage to work together to coordinate action on mental health reform and funding. We need a coordinated national approach to mental health care so that no matter where you live, you should be able to receive the care that you need. Australia's mental health system is in crisis, and now is the time to act.
My name's Rachel Green and I'm the CEO of SANE. We're Australia's national provider of recovery community and effective digital mental health care support for people and families with complex mental health needs. I'm so grateful to Allegra Spender and to Elizabeth for bringing attention to this issue. SANE's an organisation that's been advocating for a greater focus on and investment in complex mental health for 40 years, since we were founded by the mother of someone who lived with schizophrenia and died young. What we've heard today in the roundtable, hearing from the voices of lived experience, has again highlighted the burden placed on people in crisis with complex needs and families in distress to navigate the system themselves, and how hard it can be for them to find effective support. That's a role that we play in our services in helping people navigate the system. But what we need to really be focusing on here is making sure that there is a place to go once that navigation help is received. And I'm heartened to hear the commitments from the Assistant Minister today that these meetings of state and federal ministers will be coming, and I would really urge in that setting that there is thinking about a coordinated approach. Complex mental health deserves a comprehensive approach. We need to be looking at all levels of the system. It isn't something that can be solved by one type of care alone, but effective models are available, and we need to make sure that in each regional community there are place-based supports. There are supports you can access via your GP. What I try and keep in mind whenever I'm talking publicly about complex mental health is that somewhere in the audience are people who are newly facing this issue. And the other thing that we know really deeply through our community of around 46,000 members around the country at SANE is that recovery is also possible with the right early intervention, with the right comprehensive care. We hear from our community that the GP is the most consistent and long-term form of support. They need to be able to trigger that urgent access to people impacted by intense trauma, to people experiencing a first onset of psychosis, and get you access to clinical care, social work, mental health nursing and peer work and place-based services, with complex digital support providers like us connecting in between. So I'm really pleased that we're having these conversations today, and thank everyone for bringing attention to the issue.
Hi, I'm Kerry Hawkins, a National Mental Health Commissioner, President of the Western Australian Association for Mental Health, but most importantly, a family member with lived experience, having lived through decades of exactly this chasm that Elizabeth was talking to. I want to just pick up on one of the reports that Elizabeth spoke to, which was the Burdekin report 30 years ago. Brian Burdekin was a Human Rights Commissioner, and what he was talking about was the human rights of people who exist with extreme trauma and distress in their lives, whose needs are never articulated and never therefore met by services. And this is the group of people that we're talking to. I look forward to the time when their voices are heard more clearly in these conversations. I think until we have the voices of lived experience describing and defining the resources that they need to address these incredible service gaps that are really just a testament to the lack of human rights and the lack of understanding that we actually need to hear from people who are some of the most discriminated, some of the most unsupported in our communities. And that is the urgency, I think, that we're all facing at the moment, is to really start to address the discrimination that exists towards people who live with profound unsupported distress. In addition to that, I would just highlight again that family members who walk alongside people with this kind of distress are also completely unsupported. Hundreds and thousands of Australians live in quiet despair with emotional exhaustion, physical exhaustion, financial exhaustion. This is above all a human rights issue that we need to attend to, and I look forward to the day when that is foregrounded in these conversations. Thank you.
So, Elizabeth Moore, I'm President of the Royal Australian and New Zealand College of Psychiatrists. As clinicians, we also stand with people with mental illness. We stand for a collaborative, coordinated approach to mental health care. And I want to emphasise that mental health services have not been adequately resourced, and that's an issue that both Commonwealth and state and territory governments need to address. Clinicians want to be able to offer services to patients in a timely manner, in times of crisis, but also to prevent crises from happening. It's important at this round table that some of the variability that has been highlighted, some of the problems of inadequate services, especially in rural areas, are addressed. We do need a comprehensive approach. We need a whole of government approach. And that includes things like housing, education, and basic wages. But for those people with a severe and enduring mental illness, we need a comprehensive, available plan that the consumer themselves does not have to lead, or their families. So my ask for federal and state and territory politicians is that there is meaningful change. There is investment in mental health workforce so that when you need to see somebody, you are able to see somebody urgently and that your needs are addressed. Thank you.
I will say that within New South Wales, where I'm very fortunate to be living, we've received all the support we've needed. Unfortunately, because my son lives in Tasmania, he didn't receive that sort of support. He is finding it now, though. That's all I want to say.
Absolutely. I think that, it was the tragic situation that happened in Bondi Junction. It was very clear that this person had long-term mental health condition, and you may not be able to stop or prevent every incident that ever happens, but this is about dealing with the fact that this is not the first person who has had complex mental health needs who has ended up in the justice system or ended up in a terrible in a tragedy that has occurred. So we absolutely, this mental health is both about looking after us but also safety, and a key message from today was also about that investment in prevention, because it's really clear that the vast majority of complex mental health needs actually emerge in childhood or in sort of adolescence, and it is actually that we need to be getting in there. If we can do that well, if we can get in early, and if we can address the needs as they're becoming more complex, then we have a chance of minimising the sorts of tragedies that we have seen in Bondi Junction. So we have a federated system in healthcare. So you may go to your GP. You may then be at some point you may end up in the hospital. The federal government funds the GPs. The state government funds the hospitals. We have Headspace, which is federally funded. It's a bit of a patchwork, and in every community there's a different patchwork. And I think the real call is to say, I have heard time and time again of people who have gone into hospital and then gone out again and not being able to get the support that they need in the community. And it's actually that coordinated sort of step down, step up care that we have some pilot projects in and areas, but we do not have consistency across the country. And that's really where we're seeking that support.
Do you need the federal government to come in and sort of unite the states and territories, make their support services more consistent across the states and territories? And how much work is that going to take? How much funding are we talking?
So look, I might ask Black Dog to make any comments, or no, you don't want to? All right. Okay, fine. This is exactly what we're talking about. It is about, the federal government has the opportunity to bring people together, and credit to the federal government. They have said they are going to do this, and what we're here today is to say this is absolutely critical, but we need to address the long-term gaps in funding. We know in New South Wales, there are almost 30% of New South Wales people with complex mental health needs are not getting the support that they need. That has come out just recently in the last couple of months in their funding gap report. And so that's what we need to do, is get the states and the federal governments to come together and to face the facts about where the gaps are and how they can coordinate this better. And that's not simple, and it's, I've been asked this, I'll say this again, I've been asked about what is the quick fix. There's absolutely no quick fix in this space, but it is about long-term investment, it's about long-term planning, and about collectively a commitment to deliver this. Sorry?
When you talk to anybody with complex mental health needs, programs like Headspace, mental health, stuff like that, is inadequate for their needs. Is that is the federal government really placed to deal with complex mental health needs, and the programs they've got running at the moment don't meet that need?
I think it is. Those programs meet the need for some people, but not for everybody, and that's the gap that we're trying to say. And I have seen that. In my own community, people talking to me, of saying, my GP said I went to hospital, I wasn't sick enough to be admitted, but I was too sick for a different environment. And I think that is the complexity of it. It's psychosocial support as well, which is a real gap in this area. And so yes, these are the government has a role for. We do have to address those less complex needs, but it is those who are most complex that we really need to step up for. And I think the tragedy that we experience is an indicator of what happened there. I'm just calling on them to, they have said that they want to go ahead with these, and I really support this, and I'm saying, look, it's time to get the date and the agenda really set, but also that we have that commitment throughout that meeting, to an agreement that gets enshrined in the national health reform agreements. This is, mental health is not, the incidence of mental health is underfunded compared to its incidence, you understand what I'm trying to say. we have a greater incidence when you look at that versus other parts of our medical system. It is not funded at the same level, and I think that was really borne out. We are really focused on diabetes and chronic issues, and that's good and appropriate, but we don't have the same approach in mental health. And I think that's really what I think the community is seeking. And it's not just at the complex end. I hear this from the families and friends in my community, parents constantly worrying about their kids. And, the greatest fear of, I think, certainly my generation of parents is the mental health of their young people. And I know that's not going to be, social media and other things have a role in here. But it's a concern that starts and can burgeon and then can get to a terrible extent that really traumatises people's lives. Yeah. Absolutely, and I think I know others want to make a comment here, but it is that inconsistency that is I think a terrible illustration of it. There are some people, and Elizabeth spoke that there's some care that was excellent and wonderful and what they needed, but other people didn't get that, and the supports weren't there, and it's that consistency I think that we are seeking across the country, and which is so important. Sorry, did you want to speak?
Yeah, I just wanted to add that. This is something we hear day in, day out at SANE from people seeking help and from the families, either trying to seek help on someone's behalf or help for themselves. We don't have a good national approach to how we deal with trauma. There's some great work that we're part of in Victoria, helping develop a new statewide approach to trauma, but that's one state's approach. And I think Allegra's use of the word inconsistency is a really important one here. It's not an unknown. We do know what sorts of models can make a difference. The role of peer workers, mental health workers, mental health nurses, social workers, occupational therapy can play a really big role in someone's recovery if you can access them, if they're available in your area, if you can get past a wait list and if you can afford it. Similarly, models like the prevention and recovery centres, they provide a residential, non-hospital, intensive place to really build a recovery plan and stabilise and get back on your feet. There's lots in Victoria. There aren't lots in other places in the country. We have models like the Clubhouse. Clubhouse is international, has been around for 100 years, and it shows effective results through studies on reducing incarceration, reducing hospitalisation and increasing employment. But they cost money to set up, and they take a building. Digital services like ours have been shown to be effective, but we're not everywhere in the country where we want to be. So I think the thing that I'm really hopeful about is that the message is received that recovery is possible. It's not an unknown. There are plenty of opportunities of things that can be scaled, and past programs we could revisit. Programs like Partners in Recovery and Personal Helpers and Mentors made a big difference helping coordinate care for people with complex needs. And my hope would be too that in the reforms around foundational supports, there's some thinking about the return of that role in helping you find and coordinate access to the care that you need, knowing that people will need a different kind of package, taking that chronic disease approach, and that there's investment to make sure that the help is there once the coordinator identifies what you might benefit from.
Events in our nation's history, not accessing the support that they need. How urgent is this?
Look, it is hugely urgent, and it is urgent, but I am going to say it isn't a quick fix, because there isn't one thing that at a stroke of the pen the mental health, the health minister can do. And one of the messages that came from this group here was to say, what we're looking for is long-term consistent solution, not something that's going to a budget boost now that's going to droop away in another year or two. And it is about building up that support over time. So the funding step up is urgent, but it is not. I don't think this is we're going to switch a fix over. We're not going to flick a switch overnight. This is something we've got to be committed to. Because there's, nothing is more important than our mental health. It is the foundational to so many other parts of our ability to have good lives in this country. So we don't have a dollar figure on the funding because this is what because I mean, honestly, this is about partnership with the government, because again, this is actually about partnership with the government and across the parliament. We had people from across the parliament in the summit today. We also had, including members of, the opposition, who said, look, we agree this is not about politics. This is about actually, people coming together across a parliament and recognising the need and fixing it for the long term, not the short term.